Hello and welcome to MageeNews.com. I'm Christy Wilson. I'm at the Magee General Hospital Sleep Center with Dr. Rudy Runnels. Dr. Runnels, we're glad to have you.
Thank you.
Dr. Runnels is the Sleep Center's medical director as well as board certified in sleep medicine. Dr. Runnels, can you tell us about the Sleep Center and what the Sleep Center has to offer?
Well, the Sleep Center is for comprehensive evaluation of sleep problems of all sorts. The most common that we deal with is sleep apnea, obstructive sleep apnea. And it kind of comes down to being referred here by one's family physician or physician of any sort. We get referrals from OB/GYN, from neurologists, psychiatrists, really all the medical specialties refer to us. We get some referrals from ophthalmologists, since there is a link between glaucoma and sleep apnea. So we get referrals from many different specialties, ENT.
And from all over locations as well.
And from all over. We have patients that have come from Hattiesburg, from Jackson. I guess probably Jackson is the furthest we've gotten referrals from, although most of our referrals are from the local physicians.
Well, once they are referred to the Sleep Center, what must be performed for treatment and the study?
Well, what we do is we do an evaluation. I do an evaluation by asking about 1,000 questions about their sleep and their sleep history and their sleep habits. And then based on that, I determine if they are candidates and should have a polysomnogram, which is otherwise known as a sleep test. And if we do, then we schedule them. And they come in one night and they are wired up, quote unquote, where their 6 electrodes are wired to the scalp, or glued to the scalp, 2 to the face up here, 3 to the chin, 1 on each leg, a heart monitor on the chest, a band around the abdomen, a band around the chest, a little flow monitor under their nose, and an oxygen monitor on their finger.
Nothing scary, just testing.
Right. And nothing is painful. So, and then they go to sleep. And many people think they can't go to sleep with that, but we rarely have had people who actually could not go to sleep. Most everybody goes to sleep, particularly if they're, the primary symptom of sleep apnea is excessive daytime sleepiness, which means that they usually go to sleep really quickly, even with all the wiring.
So you could also just have common symptoms throughout the day-to-day life, watching TV or being in a non-active public arrangement as well?
Right. It's mostly related to daytime sedentary sitting, things like watching, well, there is an Epworth sleepiness scale that lists 8 common daytime activities that almost everybody does. And those 8 things are watching television, church or other meetings where they're sitting quietly listening to somebody else talk, riding in a car as a passenger, sitting quietly after lunch, driving, visiting with friends or relatives, and then the urge to take a nap is the other one. I think that adds up to 8.
Okay, so I know we all have busy work schedules, but if someone wants to come in, such as you, how long will it take for them to have to stay here at the Sleep Center and then they can go on back to work?
Well, we stick pretty close to our schedule in most cases. So if you have a 11 o'clock appointment, usually takes about a half hour to do the initial evaluation. And then we schedule them to come in at night, and then that's an all-night proposition from come in at around 9 o'clock, and then they leave in the morning, so they can leave as 5 or 5:30 range. Or 6,
so do they
whatever.
schedule an appointment, or can they just walk in?
No, you have to be referred by your physician to get an appointment for the initial sleep consultation.
What age groups would you define as having these sleep apneas, or based on weight, age, or as well as the work area? Is it all just based on a certain aspect, or do you just see a wide range of people with all kinds of symptoms?
We see a very wide range. We've had people in their 90s, and we've had, the youngest one we've had was less than 4. She was 3 something or other, and she had fairly significant sleep apnea. The youngest one we've had, but we have them all in between. Although the older you are and the heavier you are, and males have it a little more often than females, so the risk increases again by being older and heavier and male.
And your hours of operation?
Well, we have a night schedule and that's based upon our tech's schedule. So we are usually scheduled 4 to 5 nights per week to do the sleep studies, and I see consults on Tuesday, Wednesdays, and Thursdays, and usually from about 11 to 1 or 2, depending on, and I make special arrangements for some people. Occasionally people who have special needs for their job or school or whatever, I can come in at other times and meet them and do their consults. We try to accommodate the patients and, quote, be patient friendly.
So they'll need to have a referral from a physician, as well as then call in, to schedule an appointment, have the testing done for the diagnosis, and then come in for treatment as well. Once this treatment is performed, are there other days, more days that are required for them to get through this? Just a step-by-step and day-by-day process?
Right. After their treatment phase, their treatment night occurs, then they come in and I explain all the results to the patient and talk about the options for treatment. Most common of which is for sleep apnea is the CPAP. There's a dental option where the dental prosthesis advances the jaw and makes the airway slightly larger. And then there's a surgical option where other things are done, like removing the part of the soft palate, advancing the tongue through a surgical procedure, and the goal of all of that is to opening the airway. That's what obstructive sleep apnea is a collapse of your airway where it gets smaller and making it difficult to breathe, or number 2, it completely closing, which makes you unable to breathe while you're asleep, and therefore you have to arouse to a lighter level of sleep in order to breathe. The goal of the CPAP is to do that with air pressure, which opens the airway and keeps it open while
Are there
sleeping.
common steps that a person can take as far as getting better sleep? I know that you said the weight has something to do with it, but the age, I know you can't do anything about that. But as far as weight, I've read through your pamphlets that obesity that does have a part in this, but just other common areas that we could adjust ourselves to.
Really, the only other thing besides weight loss and controlling your weight is you're more likely to have the apneas when you're sleeping on your back. So sleeping on your side may reduce that. It doesn't for everybody, because some people have it worse on their sides, but most people have it worse on their backs when they're sleeping on their back.
Okay, so what are the consequences if someone goes untreated for the sleep apnea?
Okay, well, sleep apnea has been linked to many different diseases and actually causes some things. Like, for instance, we know that a good number of people who have hypertension is caused by sleep apnea. It's a cause. It also enters into things like diabetes. You are more likely to have diabetes if you have sleep apnea. And the worse your sleep apnea is, the more likely to have diabetes you are. Also, heart disease and stroke, and actually recently there's been a link with cancer. And the more likely, the worse your sleep apnea is, the more likely to have cancer, and less likely it is to respond to treatment. So we know that people who have sleep apnea die in car wrecks because they go to sleep, and you're much more likely to go to sleep if you have sleep apnea. Anybody who has daytime sleepiness is more likely to go to sleep and have a car wreck, but that's again the cardinal sign that you have sleep apnea. Is you have sleep apnea. I mean, you have daytime sleepiness in spite of you thinking you're getting enough time in bed. So. And you know, we all know people who have heart attacks in their sleep, who die in their sleep, who have strokes in their sleep. That's not the only cause, but it's a big cause of people who die. And you're much more likely to die from all causes if you have sleep apnea. So it's a pretty big deal, and obviously the worse your sleep apnea is, the more likely to have all of those things.
So certainly be aware of your symptoms. If you have any other questions, just to give them a call at 601-849-5277, or also visit their website at www.MageeNews.com. And we certainly appreciate the time that you have taken for this interview. Any problems that you may have with the sleeping, make sure you visit your physician, see what he has to say, and if you do have sleep apnea and he does give a referral to Dr. Runnels, this is the man that'll help you.